to TAS agency. That's Ina. Ina, can you hear us?
Добрый день, я вас слышу.
Yes, please.
Алло.
Please go ahead.
Алло.
Ина.
Добрый день.
Добрый день.
Очень приятно. Спасибо за возможность говорить по-русски. Я хотела спросить не про то, что мы прямо сейчас делаем в отношении коронавирусной инфекции, все страны мира и России, естественно, в частности. Мой вопрос касается того, что страны находятся сейчас в более или менее похожей ситуации, когда все силы здравоохранения направлены на борьбу с коронавирусной инфекцией. При этом мы понимаем, что неинфекционные заболевания никуда не ушли. Рак не ушел на карантин, сердечно-сосудистые заболевания остаются. И даже вот эти 2 месяца самоизоляции нам дадут в будущем проблемы у людей со здоровьем. Что планирует ВОЗ в этом отношении рекомендовать, когда мы начнем выходить из этой самоизоляции? Спасибо.
May I just for others who are watching us on other platforms to repeat what was the question? The question from Ina is about non-communicable diseases. We know about COVID, what's going on, but what about lockdown, people who stay home for months now, how that could have a repercussion on some other conditions they may have?
There is no doubt that certainly the lockdowns have had a major impact on social, economic, and also on the delivery of other health services. Health services themselves and health systems and whole hospitals have become overwhelmed. The disease was not contained or suppressed initially in a way in which the hospitals could be protected. So in that sense, people lost access to the hospitals because they very often became overwhelmed by COVID cases, or elective surgery was cancelled as a means of creating hospital beds, which is perfectly appropriate. But elective surgery does not mean unnecessary surgery, for example. That's elective in that it can be carried out in a planned way. It is still necessary surgery. Cancer chemotherapy, others, immunization programs in many countries are an absolutely vital defense against other infectious diseases. So there is no doubt that other health services have come under pressure in all systems. And we've had a group working very, very hard on sustaining continuity of other health services during this time, so that basic, essential health services under the Rubicon of universal health could be and can be still be provided. And therefore, no one would like to see the public health and social measures, those broad-based measures which many people refer to as lockdowns. Everybody wants to be able to see those lockdowns transitioned away from. It's very important. The difficulty is that those measures were put in place to suppress what was an intensely burning epidemic. They were an emergency measure put in place by governments who had seen an exponential rise in cases, and in many cases, unlike in the cases of some of the Southeast Asian countries, the initial attempts to do containment failed, and the disease spread and accelerated. And in that situation, there was very little option for countries but to impose this type of lockdown. The difficulty is unlocking or transitioning away from those measures means there is always the chance that the disease may rebound. And we've been saying quite clearly, in order to move away, and we need to move away from these lockdowns, but we need to not move away from lockdown. We need to move towards something else. Moving away from a bad thing or something that was necessary and that has done has caused so much hardship for people is a good thing. But if you don't move towards something else, you may be back exactly where you started before you know it. And we need to move towards empowered people and communities who understand how to protect themselves and how to protect others, and who are willing to continue with the degree of personal hygiene and physical distancing that will be necessary going forward. We need to move towards stronger public health capacities, not just testing. Testing is a hugely important central piece of surveillance, but we need to train hundreds, thousands of contact tracers. We need to be able to find cases. We need to be able to isolate cases who are confirmed. We need to be able to quarantine contacts. We need a system. We need an absolutely massive increase, the same massive increase we saw in the health systems, in healthcare, in ICUs, in ventilators. That's all we seem to talk about is ventilators. They're very important. Absolutely very important. But we need to start talking about contact tracers. We need to start talking about quarantine facilities for contacts. We need to start talking about community-based surveillance. We need to invest in the alternative to lockdown. And we need to strengthen the healthcare system at the same time, so the same tragedy of overwhelmed health systems does not emerge again should the disease rebound. We have said this since the beginning of this pandemic. We have said this since the beginning. So we will work with countries and support them to put in place those systems. And we see many countries moving very carefully and in a very united way towards those objectives. And we will continue to support those objectives. But in the and if we do that, then our hospital beds are freed up, our clinics are freed up, people can go back to see the doctor, and our essential health services can come back online. Because nothing is more important than that right now.
To add to what Mike has said, we have issued some guidance about maintaining essential health services, because this is absolutely critical that other services continue. You know, babies are still being born, and children need vaccinations, people need vaccinations. This needs to continue, and it needs to be done in a safe way. So we do have guidance that has been put out to try to support countries in trying to maintain that. We've also seen some innovative ways in which countries have been able to use telemedicine, for example, so that there are still a continuous way in which doctors can speak with their patients, and so that they can maintain that care. And it will be temporary, as we've said, that, you know, once the measures are able to be lifted, once these public health and social measures are able to be lifted, these services can get back online. We've seen countries be very strategic in the way that they care for patients. Perhaps in some areas that are overwhelmed with large numbers of patients, they're either not cared for in that specific locale, they're moved to other parts of the country. We've seen some countries who are having low incidence accept patients from countries who are having explosive outbreaks. And that solidarity and that support and that generosity, you know, is really welcomed. And we're very grateful for that. And I'm sure all the countries are grateful for that. But it is important that essential health services continue. We have large groups within WHO and our partners in ministries of health and across different sectors who are trying to continue all of those services. And we will continue to support countries in doing so throughout this pandemic.